All right, hello everyone, and welcome to today's webinar titled Tick-Borne Diseases, a CDC Update, with featured speaker Dr. Grace Marks, an infectious disease physician and medical epidemiologist with the Centers for Disease Control and Prevention's Division of Vector-Borne Diseases. My name is Chelsea Gridley-Smith. I'm a Director of Environmental Health here at NACCHO, and I'll be helping moderate this webinar today. Before we begin, there are a few announcements to go over. One, you will use your computer speakers to listen to today's presentation. You are encouraged to use the Q&A box to ask any questions you may have throughout the duration of the webinar. At the end of the 45-minute presentation, our speaker will address your questions in the order that we received them. This webinar is being recorded, and a link to the recorded webinar and the presentation slides will be distributed to all participants and shared on NACCHO's Vector Control webpage following today's event. Some of the resources discussed today can be accessed in the files and web link boxes on the right-hand side of your screen. And to introduce today's speaker, Dr. Grace Marks is an infectious disease physician and medical epidemiologist with the Bacterial Diseases Branch at CDC's Division of Vector-Borne Diseases and a lieutenant commander in the United States Public Health Service. Her primary areas of interest include the epidemiology of Lyme disease, tularemia, and plague, as well as the prevention of tick bites and tick-borne diseases. She received her Doctor of Medicine and Master of Public Health and Epidemiology degrees from the University of Washington and maintains board certification in both internal medicine and infectious diseases. As an officer with CDC's Epidemic Intelligence Service Fellowship Program, she was stationed at Tri-County Health Department, the largest local public health agency in Colorado. Grace, the floor is yours.
All right, thank you, Chelsea, for that introduction. Can you hear me okay?
Yep, you're coming in loud and clear.
All right. Well, good morning. As mentioned, my name is Dr. Grace Marks, and today I'm pleased to share with you an update on tick-borne diseases. Just make sure the slides are advancing here. I have two main objectives for my talk today. First, I want you to understand the challenges related to ticks and tick-borne diseases. Specifically, I'll be sharing information about the expansion of tick vectors and the increasing incidence of tick-borne disease. Another challenge often faced by local public health agencies is the burden and complexity of Lyme disease surveillance and reporting. My second objective is to share some new materials that we've put together at the CDC that we hope you'll find useful in your communities. These resources include one-page informational handouts, scripted PowerPoint presentations, and new tick surveillance guidelines. We have a problem in the U.S., increasing incidence of tick-borne disease. The majority of the vector-borne diseases reported in the United States are caused by pathogens spread by ticks. Cases have been reported over an expanding geographic range, and this is attributable in part to expanding ranges of vector ticks. In addition, an increasing number of organisms spread by ticks have been recognized as human pathogens. Of the over 62,000 reported cases of vector-borne diseases in the United States in 2017, 95% were caused by pathogens spread by ticks, and most of these, as you can see in this graph, were Lyme disease. Only 5% of the reported vector-borne diseases in the U.S. in 2017 were spread by mosquitoes or fleas. This is a graph that shows the number of reported Lyme disease cases from 1992 to 2017. In 2008, the National Surveillance Case Definition was revised to distinguish between confirmed and probable cases. In this graph, confirmed cases are in blue and probable cases are in green. You can see that the trend has been one of steadily increasing numbers of Lyme disease cases since the early 90s. Lyme disease cases are highly localized in the U.S., with over 95% of Lyme disease cases reported from only 15 states in the Northeast and Midwest regions. In these maps, one case of Lyme disease is represented by a blue dot. The map on the left is a snapshot of Lyme disease case distribution in 2001. The slide on the right shows the distribution in 2015. As you can see, during this period, there was significant geographic expansion of Lyme disease cases in all directions. The next few slides show a general timeline of when tick-borne pathogens were first established to cause human disease. The color of the diamond on the graph represents the tick species vector for that pathogen. As you can see, the pathogen rickettsia that causes Rocky Mountain spotted fever was first identified in the early 1900s. The tick vectors that cause tularemia, tick-borne relapsing fever, Colorado tick fever disease, and Powassan encephalitis were also identified in the first half of the last century. Borrelia burgdorferi, the primary pathogen responsible for Lyme disease, was not identified until the early 1980s. Since then, a number of other tick-borne agents and their vectors have been identified. Since 2000, you can see that the rate of discovery of tick-borne pathogens has increased, including two novel Borrelia species, Borrelia mayonii, which also causes Lyme disease, and Borrelia miyamotoi, which causes a form of tick-borne relapsing fever. The tick Ixodes scapularis has become an increasing public health threat as more pathogens have become prevalent in this tick population. As you can see from this graph, this single tick species is known to transmit 7 distinct pathogens that cause human disease, including Borrelia burgdorferi, the spirochete that causes almost all Lyme disease in the U.S. Since 2017, we've become increasingly aware of a new potential public health problem, an invasive exotic tick species. Haemaphysalis longicornis, also known as the Asian longhorned tick, was first identified in the U.S. in 2017. This exotic Asian tick has rapidly expanded to 9 states. H. longicornis is a known serious pest of livestock in the Australian and Western Pacific regions, where it is established. It is an aggressive biter of domestic animals and frequently builds intense infestations. Up to thousands of ticks may be found at a time on an animal. This type of infestation can cause great stress, reduced growth and production, and severe blood loss. The tick can reproduce without a male, so a single-fed female tick can create an entire population. It is a known vector of several viral, bacterial, and protozoan pathogens that cause disease in livestock and humans, but as of April 5th, 2019, no human pathogens have been identified in the Asian longhorn tick in the U.S. As of February 12th, 2019, the USDA reported that 9 states had confirmed local H. longicornis tick populations. The number of counties in each state where this tick has been confirmed are listed on the right in this bar graph. Contributing to the public health problem of tick-borne diseases is the ever-expanding geographic range of tick vectors. These two maps show the geographic spread of the Lyme disease tick vectors between 1996 and 2015. Lyme disease on the west coast is transmitted by the tick Ixodes pacificus. In the east, Lyme disease is transmitted by the tick Ixodes scapularis. Established populations of these vectors are shown by the green and red colors respectively. Reported populations of these ticks are shown by the colors yellow and blue. As you can see, these highly problematic tick species have become much more established. Over the course of just 2 decades, the number of counties where Ixodes scapularis was reported as established more than doubled, with most increases in the Northeast, Mid-Atlantic, and Upper Midwest. The distribution of ticks and tick-borne disease agents change over time. As a result, the likelihood of human encounters with the ticks also changes over space and time. Tick surveillance is intended to monitor changes in the distribution, abundance, and infection rates in medically important ticks to provide a scientific basis for public health action. Tick surveillance provides important data that informs public health action. Knowing where ticks live, detecting which pathogens are present in tick populations, quantifying how often those pathogens are present, and identifying when ticks are most active and thus most likely to bite humans is critical information for clinicians, the public, and policymakers. Tick surveillance can explain and predict trends in tick-borne diseases. Tick surveillance can also explain how differences in tick behavior can be relevant to human disease. For example, Ixodes scapularis ticks in the south rarely bite humans, instead preferring to take their blood meals from reptiles and other animals. This preference explains why Lyme disease is so rare in the south, despite the tick vector being established there. Tick surveillance can also help to quantify risk of human exposure to pathogens of tick-borne diseases that are not notifiable. And finally, tick surveillance can predict where tick populations are likely to expand, and as a result, where tick-borne diseases are likely to be found. Not all ticks cause disease. At the CDC, we are most interested in ticks that pose threats to public health. These are the ticks that frequently bite humans and are capable of causing human disease. Ticks of public health significance are able to acquire human pathogens during blood feeding, are able to maintain infection between life stages, and then are capable of transmitting pathogens to humans through a tick bite. Of more than 80 tick species in the U.S., only about a dozen are ticks of public health significance. Each tick has a unique geographic distribution and set of human pathogens it transmits. These maps show the geographic range of 6 ticks that bite humans in the U.S. As you can see from these maps, every state in the continental U.S. has ticks that bite humans and that are capable of transmitting pathogens that cause human disease. As a result, people in every state are at risk of some tick-borne disease. While knowing that the tick is present provides a key piece of information in assessing risk for tick-borne diseases, knowing if human pathogens are in those ticks and at what prevalence, and understanding how commonly humans might encounter infected ticks provides a much better estimate of the risk of human disease. 3 tick species cause the majority of tick-borne disease in the U.S. The top map shown here shows the distribution of Ixodes scapularis, also known as the black-legged tick. The list of human diseases that it transmits is listed on the left. The bottom left map shows the distribution of Amblyomma americanum, better known as the Lone Star tick, which transmits pathogens responsible for ehrlichiosis, Heartland virus disease, and tularemia. On the bottom right is a map of the distribution of Dermacentor variabilis, the American dog tick, which can transmit Rocky Mountain spotted fever and tularemia. The CDC has 3 specific goals for tick surveillance. First, these data will help us to update species distribution maps by showing where ticks have been reported and where they are established. Second, tick surveillance will help to define which pathogens are present in ticks and how prevalent those pathogens are. And third, these data will help to assess regional differences in the density of infected ticks that are host-seeking, that is, the density of ticks that are likely to come into contact with and bite humans. Public health surveillance of Lyme disease faces several unique challenges. These challenges can vary widely based on Lyme disease incidence. Surveillance of Lyme disease in areas with low and emerging incidence provides valuable information to public health. It is very helpful to have as much accurate information about cases as possible to better understand local risk of disease and to inform communication efforts. On the other hand, we know that there can be limited public health utility of traditional Lyme disease surveillance in many areas with high incidence of Lyme disease. We know that Lyme disease occurs in the same places at high levels year after year. Counting each case requires a lot of effort on the part of local healthcare providers and local and state public health agencies. For many of these agencies with limited resources, it often becomes hard to justify this burden of reporting when they know that often their work does not result in new public health action or messaging. The message that Lyme disease is a big problem and that accurate and early diagnosis and treatment is critical remains the same. Clinical and public educational activities and outreach will remain a top priority and occur to the extent that resources allow. Acknowledging the challenges and limitations of traditional Lyme disease surveillance, CDC is actively exploring a broader concept of Lyme disease surveillance. This concept builds on information obtained through traditional passive public health surveillance and adds novel data streams to better characterize Lyme disease patterns and distribution. Some of these new data streams include medical insurance claims data, advanced molecular detection of pathogens in human specimens, syndromic surveillance of emergency department visits for tick bites and Lyme disease, and systematic tick surveillance, as was described earlier in this presentation. Local public health agencies play a critical role in local outreach and education about tick-borne diseases. Examples of potential local partners include academic institutions, schools and school-based health educators, commercial entities, and special interest groups. Colleagues at local public health agencies often reach out to us at CDC to ask about materials and content that they might use when engaging with local partners for outreach and educational efforts. One of the ways that we respond to these requests is to put together durable materials that might be used by our local public health counterparts. For the last few minutes of this webinar, I'd like to share information about CDC resources that we hope you will find useful in your communities and efforts to prevent tick-borne disease. We will be placing many of these newly developed resources in an updated NACCHO Lyme Disease Toolkit, which we expect to be available very soon. We are grateful for the opportunity to partner with NACCHO to promote these materials to our local public health agency partners. We're also very interested in feedback from these partners. Our goal is really to try to make your jobs easier. Please let us know if there is additional material that would be useful as you share science-based information about tick-borne disease prevention, diagnosis, and treatment. I also wanted to note that we will be sending an email to all registered participants of this webinar with a link to the updated Lyme Disease Toolkit once it becomes available. The toolkit will include one-page info sheets for the general public and for healthcare providers that describe what to do after a tick bite. Tick surveillance guidance for both Ixodes scapularis and Ixodes pacificus, the two ticks that carry the bacteria that cause Lyme disease in the U.S., will also be available. The toolkit will also include 2 scripted PowerPoint presentations that can be used during outreach to health educators, clinicians, and other local stakeholders, as well as for use for public health staff training and orientation. Again, we expect this updated Lyme disease toolkit to go live soon, and we'll let you know when it does. This is the Ixodes scapularis tick surveillance guide, which is currently available on the CDC tick website at the link shown above. This is a technical document intended for local and state public health partners who are interested in developing a local tick surveillance program. The document provides clear, standardized guidance for tick collection, pathogen testing, and surveillance reporting. The tick surveillance guide for Ixodes specificus is similar to this one. Additional surveillance guides for other ticks of public health significance are in development. The two scripted PowerPoint presentations were designed in response to requests from multiple public health agency partners. The first presentation was designed to provide basic information on tick-borne disease prevention and an orientation to Lyme disease. This presentation could be used to provide a basic introduction to these topics and might be most suited to a general public audience. The second presentation is specifically designed for public health professionals in jurisdictions with low and emerging Lyme disease incidence. We know that Lyme disease surveillance is complicated and that there are a lot of surveillance nuances that are specific to low incidence states. We hope that this presentation will serve as an orientation or a refresher of Lyme disease surveillance for epidemiologists and disease control specialists in these low and emerging incidence jurisdictions. We have also developed two one-page info sheets that explain what to do after a tick bite. The first info sheet is intended for a general audience. The second is intended for healthcare providers. The information includes how to remove a tick, what symptoms to watch out for, and it also addresses some common questions that come up after a tick bite. Many other resources are also available on the CDC tick website. A comprehensive reference manual of tick-borne diseases for healthcare providers is available in PDF format on the website and can also be ordered free of charge. The detailed pictures of ticks and the tick distribution maps can be very helpful for the provider when a patient presents after a tick bite or with a possible tick-borne disease. Please note that this is also available in the NACCHO Toolbox as a standalone downloadable toolkit. A recently updated brochure about Lyme disease is also available online and can be ordered at no cost. This mailer covers information about Lyme disease including transmission, prevention, diagnosis, and treatment, as well as tick removal tips. Finally, a trail sign is available for download on the CDC website, which provides information on tick bite prevention. This trail sign can be also ordered from CDC website as a pre-drilled trail sign that is coded to protect from sun damage. That concludes this webinar. I would like to thank you for your attention. Before taking questions, I would also like to thank our partners at NACCHO for making today's webinar possible. As you can see here, I'm also including information about how to reach out to us with specific questions and feedback. We really do appreciate your time and thank you for the work that you're doing on the ground.